Hello, good afternoon, everyone. I'm Amin, Senior Physiotherapist and your moderator for today. On behalf of the team at ReGen Rehab, I would like to welcome you to today's session. Today we have Dr. Kavitha Ranalingam, Consultant Rehabilitation Physician at ReGen Rehab Hospital, who will share with us a few tips on how to stay motivated after suffering from a stroke. Welcome, Dr. Kavitha.
Oh, my face isn't up yet.
Okay.
Thank you, Amin. A very good afternoon to everyone. The path to stroke recovery is a long one, which can seem endless and full of obstacles. Motivation plays an important role towards successful stroke rehabilitation. If a stroke survivor is not motivated, there will be reduced participation and engagement during the rehabilitation program, which may lead to slower recovery, frustration, and depression. However, motivation during stroke recovery doesn't just come from within, it comes from the people around the stroke survivor. So if you are a stroke survivor, or if you have a loved one, if you're a loved one to a stroke survivor, it is important to understand the role of motivation in stroke recovery and the challenges that can get in the way. Here are 7 tips that may help you or your loved one stay motivated and keep your momentum going. Tip number 1, goal setting. Goal setting is possibly the most powerful tool to motivate people, especially when the goals are clear and personally relevant to the stroke survivor. Goals need to be realistic, personalized, functional, and meaningful. In developing a realistic goal, it is important to work with your rehabilitation team. Factors such as any underlying medical condition, your cognition, which is the ability of your brain to process information and remember things, which can be affected after a stroke. Also, your strength, sensory ability, and other factors need to be taken into account when deciding on realistic goals. Besides being realistic, the goal needs to be personalized. This is usually based on an activity the patient was able to do before the stroke and on the patient's wishes. When the goal is personalized, then it becomes more meaningful to the patient. Your rehabilitation team will then help you to create SMART goals. SMART goals are goals that are specific, measurable, attainable, realistic, and timely. That means within a certain time frame. Tip number 2, don't compare. Watching other stroke survivors achieve their goals makes it tempting to want to set the exact same goals for yourself. You might think to yourself, hey, if it worked for them, it'll work for me too, right? Well, not quite. Every stroke recovery is different, which means that everyone's goals and results will be different too. So focus on yourself and set your goals with your personal capabilities in mind. Tip number 3, keeping a journal. Keep a journal or a diary and celebrate any progress that has already been made. While setting goals is very important in a rehabilitation program, staying focused on the end result is not always a good idea. So your goals need to be divided into short-term goals and long-term goals. If you stay focused on a long-term goal without setting short-term goals, you will lose the motivation along the way as your eyes will be set too far ahead. It might make you feel that you're not making any progress or enough progress to get to your long-term goal. So a clearly defined path to a long-term goal with many small goals along the way gives a stroke survivor something optimistic to strive for. For example, a common goal that our patients have is to be able to walk again, perhaps with a walking aid. But after a severe stroke, you may not even be able to sit up on your own. So short-term goals could look like, first, sitting independently for 10 minutes, then standing with one person helping you, then perhaps standing on your own for 5 minutes, and maybe after 1 week, being able to take 5 steps with a gait aid and one person assisting you. And then maybe after another 2 weeks, being able to walk to the bathroom with a gait aid. So stay focused on the process and the next short-term goal rather than the end result. Try to keep a journal of the small steps in your recovery process, focusing on what is happening right now and celebrating small improvements will boost your confidence. Tip number 4 is to find motivation in hobbies. This in itself is very much related to goal setting. Everybody tends to have at least 2 activities they love and enjoy. These activities could be like gardening, painting, cooking, or a sport like bowling or even diving. Goals can be easily created based on past hobbies that you might have been passionate about. Music appears to be a hobby that is especially useful. Many studies provide evidence that music enhances focused attention and verbal memory while your brain is recovering. Music therapy is not only about listening to music, but it is also about creating music and being allowed to express your creative self. Tip number 5, join a stroke support group. Here you get to connect with other survivors and caregivers to share experiences, information, and advice. This can prove to be very beneficial as you may be able to find people who have already problem solved difficult scenarios that you are currently facing. And this can help you get beyond your limitations. In this time of COVID-19, it would be a good idea to join an online stroke support group. Online support groups usually have good resources for both a stroke survivor and caregivers, as well as forums and chat rooms to encourage and be encouraged. Tip number 6, try try gratitude for a great attitude. Okay, so gratitude means to have an attitude of thanks or thankfulness and appreciation for what you have. Studies have found that gratitude is not just a pleasant, passive emotion that may breed laziness, but rather an activating, energizing force that helps us to pursue our goals and become better, more socially engaged people. So the next time you feel like you need a bit of motivation, try some gratitude instead. Go online for motivational tools that help you to generate thoughts of gratitude. Last but definitely not least, is to manage depression and apathy after a stroke. Depression and apathy after a stroke is very common. This is not caused by a defective personality or lack of willpower, but is due to stress and biochemical changes that are happening in the injured brain. Depressed survivors often have difficulty with motivation because there is no joy in doing anything. Indeed, this is one of the defining characteristics of depression, a loss of interest or pleasure in activities that were once enjoyed. If you feel depressed, the first step is asking for advice from the doctor in charge of your rehabilitation program. There are medications that can help reduce depression and apathy, which are barriers to achieving good progress in rehabilitation. So here you have it, 7 tips that I wanted to share with you today on how to be more motivated or how to maintain motivation during your during your rehabilitation program. Thank you very much for listening.
Thank you. If you're having questions, please drop your questions in the chat box below. Thank you.